Hello, this is Dr. Serrano, your friendly nephrologist and vascular interventionalist, here again talking about dialysis today. Have you been told that your kidney is so diseased now that you need to consider dialysis? Do you feel like you've been given no other options but to basically get a catheter in your chest or a fistula in your arm so that you can initiate dialysis? Many patients have come to me in my practice and have had concerns about the way they've been approached by other doctors and that they feel forced into starting or initiating dialysis. If you've been diabetic or hypertensive for a long time, then you will have some sort of sequela from that diabetes or the hypertension. Usually the kidneys are affected to a certain degree, and when you reach about 15% kidney function is when you may start feeling some symptoms that will indicate that you may need to go on dialysis. Now, sometimes you don't feel those symptoms. Sometimes you just have metabolic irregularities in which case your electrolytes are irregular, abnormal, and you need to correct those with the renal replacement therapy. Sometimes you will be advised to initiate dialysis because of these irregularities. Yet I do find that many doctors jump the gun and that they start to prescribe the dialysis modality before they actually should. In many occasions, you are able to correct these electrolyte abnormalities as well as other abnormalities, including fluid abnormalities, with just taking medications. And if your doctor is giving you the wrong medication, then you won't be able to control these abnormalities as well, in which case you will get frustrated and probably agree with him and that you should start dialysis. It takes a good nephrologist, a good kidney specialist, to give it the best shot that you have, give you the best shot, and adjust your medications to an extent where you won't be at risk of any adverse events. Beyond that, there is also what you feel. So you may not always feel that you are sick, but you may need dialysis because you may have elevated serum potassium, you may have acidotic blood, or too much fluid in your lungs, yet you may not entirely feel that bad. When your blood urea nitrogen starts to get very high, that's when there's some correlation with feeling bad. You may feel nauseous, like throwing up. You may feel like you're not very hungry. You may feel like you're itching all over. There could be lots of toxins in your blood, in which case you may decide that you're symptomatic enough to start dialysis. This may not be life-threatening, but you may decide that you may want to avoid those symptoms by cleaning your blood with the dialysis machine. Now, even in this case, or in these cases where you have lots of toxins in your blood, if you have a good nephrologist, a good kidney specialist that knows what he's doing, what he or she is doing, you may be able to avoid dialysis and have less symptomology in reference to your kidney disease. So, you may be wondering what the products in front of me are, and I'd like to again introduce to you Rhinanol, which is a probiotic that helps you alleviate some of the symptoms of kidney disease and could help you avoid dialysis. In fact, as you've heard me say before on many occasions, you might even help the kidney rest and recuperate some kidney function. And we've certainly seen that happen time and again. Along with the probiotics that are available to help your symptomology out in patients that are end stage or close to end stage renal disease, the doctor needs to also regulate all other parameters very strictly, including blood sugar, blood pressure, bicarbonate in the blood. He needs to regulate your potassium, your serum potassium, and other electrolytes as well that are in the blood, your phosphorus, your calcium, magnesium, so on and so forth. And what we see is that once all of those are strictly regulated and you are taking probiotics, there are many patients that are able to avoid dialysis altogether. Now, this isn't really that popular with doctors because there are some financial issues that are involved with dialysis. It is a very profitable business, and I believe practitioners are very quick to jump onto the dialysis modality, a lot quicker than they should at times. I've seen it time and time again in hundreds of my patients. In fact, many patients have been recommended dialysis and come to me and have lasted years, 10 years or longer, with avoiding dialysis with our therapy and being very strict in what we do. Additionally, many of them have improved their renal function to the point where it hasn't been seen that frequently before in other practices. Currently, I'm in the process of publishing some of this information from patient charts, and I am collaborating with certain universities to do so. But since I am very aggressive in trying to treat patients who never intended to be on dialysis, patients who refuse to be on dialysis, or connected to any life-sustaining treatment or machine, then I believe we've done a fantastic job in treating them, keeping them off dialysis, and making them feel great. So the next time you're told you need to start dialysis or your kidneys are too far gone, remember there are other options. Probiotics, Rhinanol is one of those options. We have other products that we will talk about at another time, but you should consider these alternatives, especially if you never intended to be stuck to a machine, especially a dialysis machine. Until next time.